Good evening, my name is Mark Elliott and I plan to talk about my diagnosis and my treatment which I started today. So just a quick brief and a heads up of how it's all begun. I found a lump in my neck towards the end of last year. Brushed it to one side, to be perfectly honest, as us blokes do, till maybe six weeks ago or so. I was having a wet shave and found a lump in my neck, quite a sizable lump. Obviously it was there last year. I brushed it to one side, as blokes do, but it grew quite big, and obviously I couldn't, and I had to face up to it. Went to my doctors. My doctors referred us 2-week referral to the specialist, who was doing an MRI, CT scan and a biopsy, which a week later, after all them tests were done, I got the news that I had cancer of the tonsil, in the right tonsil, and also I've got a big lump in my lymph node. Now on the positive side, it hasn't spread, it is contained there, and the plan is to treat me to cure it, which has a very good success rate. So today was the start of my treatment. I finished work Friday in preparation for my treatment today. So today my treatment plan started, and it consists of 6 weeks. 6 weeks of radiotherapy every day, followed by 2 sessions of chemo. 1 a day, week 1, day 1, and 1 at the beginning of week 3. So before my treatment started, I spent many hours looking on YouTube, see if I can find information, and just because you read a lot of stuff, and to be perfectly honest, what you read probably it does scare you. So even by me just talking about this today, and if it can help one person, that's great. So I started treatment today, went there at 8:15 this morning, got me obs took. First of all, last week I was in Friday, taking bloods, checking my blood pressure. I also watched a video about the chemo. That's Friday, so today was the first day in. I can see I went in 8:15. They retook me blood pressure and weight, checked my bloods, put a cannula in. It's quite sore now. Put a cannula in there. Then I had 2 hours of pre-hydration. Basically, they pump you for 2 hours with fluid, helps the kidneys and everything like that, ready for the chemo. So I had 2 hours doing that. Then I had half an hour getting anti-sickness drugs pumped in, as well as steroids, which I took orally. After that was the treatment. My treatment, I thought infusion, which I was told, would last 1 hour. However, I was informed on closer inspection, my infusion would be 3 hours, with it being quite a high dose. So basically, instead of getting 1 chemo once a week, 6 weeks, I'm getting 2. So basically, 3 weeks chemo in one, followed by week 3, again another 3 weeks in one, hence 2 weeks only of chemo. Now I was told, because I was young and relatively fit, that's the way they were going with me, so be it. So 3 hours infusion with the chemo, followed by another 2 hours of post hydration, and it flushes you out. And so after the 3 hours infusion with the chemo, obviously post flush, originally I was due me radiotherapy treatment at 12:15. Obviously at 12:15 I was hooked up to the chemotherapy shot, couldn't go down. So once the chemo was out of the way, we went down the radiotherapy. Now I was a bit anxious about the radiotherapy. I had my mask fitted last week, 2 weeks ago, and anyone who's had the mask fitted might not like it. Some people might find it fine. I don't know. To be honest, I didn't like it. I got my MRI scan with the mask on, my CT scan with the mask on, all part of the treatment plan. And like I say, to be honest, I didn't like it, so I was a bit anxious going down. However, I got there, met 2 lovely young nurses in the radio. Getting his name. Anyway, I met them both, and they were great. Put us at ease straight away. Put the mask on, got clipped down. And it was over in maybe less than 10 minutes. There was really nothing to worry about. So come out of that all good. Went back upstairs, finished off my post hydration. Now I'm back home. It's now 5:30 at night. I started my chemo at 12. I finished it at, I think it was 3:30. But all in all, from 8 o'clock, from the pre to the chemo to the post, I didn't get away till 6. That was from 8 o'clock this morning. So it's been quite a long day. But today has been nothing at all to worry about. At the moment I feel totally fine, don't feel no different, don't feel no sickness, even though I've had a really high dose of it. I feel fine. We've got a Domino's on with tonight, pizzas and chicken wings. Why not? Let's enjoy it while we can. I've also been given some Flamigel to use. That's for the radiotherapy, so you put it all over your neck and just it stops with skin reaction and helps, I believe. So you put that on 3 times a day, 3 to 4 times. I put it on once when I got back. I will put it on again before I go to bed. Also started me mouthwash I was given. This will help with all the mouth problems we may get, i.e. mouth sores and ulcers, this and the other. I believe this will help it, so I'll start that night again. I did that once, and I will do it before I go to bed again. And we do that it recommends 4 times a day here. So yeah, 4 or 5 times a day. One thing I will say, what I've noticed is the treatment's going to be hard as it goes and progresses on, but one thing we must do, we must look after ourselves, we must take care. i.e. by doing your mouthwash, putting your gels on, taking your painkillers, being clean, looking at personal hygiene, everything like that, drinking plenty of water. I think you've got to help yourself first and foremost, because if we can't help ourselves, then who can help us if you can't help yourself? So I think it's important to get it all squared away, take your medicines, take your creams, and really help yourself. So yeah, that's where I am. Day 2 tomorrow. Obviously no chemo, just radiotherapy. But like I say again, now within 10 minutes. It's nothing. Absolutely nothing. And that's it. I've got my little conservatory set up. My laptop's up there. I've just been getting a wall planner. My start date and the end date. I think this is a nice little space for myself. As the treatment goes on, it's nice and airy. I can open the doors, sit in my garden, get lots of fresh air. So yeah, I can watch me telly. Yeah, to be perfectly honest. I've also been buying a temperature gauge. It's only a cheap one. The pharmacist recommended this one rather than spend money, just so I can keep an eye on my temperatures. And if I'm not feeling the best, make sure I haven't got a temperature. Anyway, I'm feeling really good, really positive, and I'm 110% ready to kick the arse out of this. There's no doubt in my mind, and that's what I will do. 110% positive all the way. The only way to look is up. No matter how hard it gets, look up. So, like I said, if me talking about this can help just one person, because like I say, I looked on the internet and I couldn't find nothing apart from all the medical stuff. I'm just a normal lad, and I'll just tell it how it is. I'll try and put a video on every day and talk you through it if I can. So yeah. Right, I'm off now. I'm going to get me pizza and chicken wings. In the meantime, if anyone wants to ask me any questions, please feel free to ask away. Okay? Right guys, see you later for now. Bye bye now.